Is it okay? So the third and fourth questions are the most important ones. So the first and the second, maybe we spend less time on it, only a brief discussion. Then, what are the core?
进来点，
差不多。
Come
Okay.
closer.
What do you think are the causes or factors of illness?
The personal behaviors and some social and environment factors, such as the housing conditions, the workplace environment, and the personal lifestyles.
Yeah, such as a poor diet may cause several illnesses.
How about you? Third one? The first one. Do you have anything else to add?
Pollution in the environment.
Okay. The environments. So, anything else about the first question? Okay, then we'll move on to the second one. What are the two models of health and illnesses? Give a brief explanation.
Social models and cultural models, a medical model and a social model.
To give a brief explanation.
The medical model is only focused on the physical diseases and the treatment of the diseases. But the social models not only focus on the physical diseases, but other things like
Cultural,
cultural, mental, yes.
Do you have some other opinions?
Medical, social model. I think in the medical model, people pay more emphasis on treating instead of prevention.
Yes. In the medical model, the principle is that a body is a machine, and if health, our body functions well. But if we are ill, we need to be fixed.
Okay.
Yeah.
Then we say more about medical. Then how about social?
Social model.
Social model.
It just attributes more factors to the illness. Maybe the first factor that can affect your health could be lifestyle, and it also say social and community. This could be the second factor, and also the social, economic, cultural, or environmental factors. It's very abstract.
So we can move on to the third one, which is it's more important question, so we can discuss for longer time in it. So do you think society have more impact on health than individual health?
I think they are both important, but their impact are equal, which means that the individuals, if individuals have good lifestyles and personal behaviors, but the environment is not so good. Just like in China, Beijing had the smog, the haze. So people also need or also have high chance to get illness. However, if the environment is good, but the people are not active lifestyle, do not have active lifestyle, they also are more likely to get illness.
I think for me, both individual and society affect, but I prefer that society have more impact because I think it's inevitable for everyone to get sick or have some illnesses sometimes, and so for me, what matters is whether the society can provide you a fair or timely curements for you, or what's it? Whether it can provide, I mean, enough healthcare resources for you. So I think this is what matters. Whether it's adequate, whether it's cheap or very expensive, and whether it's effective. Yeah, I think that there are more social factors.
I think society has more impact on our health because according to some tables in the reading text, the poor are more likely to have illness and sickness than the rich, and most of people live in the same environment, but poor people are more may have more risk of some diseases. So I think society is more important than individual habits and lifestyles in terms of health, ill health.
Sorry, I don't understand. You say poor and rich live in the same environment, but the society has more impact compared with the individual factor. What do you mean?
Society, parts of society containing housing condition, environmental conditions, and insurance, pension, all of these. Apart from individual causes, all of them are society causes.
Yeah. Also, I think there could be some social class inequalities which can affect your health also.
Yeah.
For example,
Such as the cultural explanations, just as Ling right, mentioned before, those suffering from poor health have. I mean, you said some poor people may suffer from more opportunities, possibilities of specific illnesses, right? Than the rich person, than higher class. Yes, and also, yes, so.
so let's make a brief summary.
Yeah.
Claire points out that Claire thinks both individual and society have the equal impact on health, don't you?
Yes.
Yeah, you think people's lifestyle and their personal behavior affects themselves,
Yeah.
while also the environment have some impact on their health.
Yeah.
They're equal. You
Yeah.
mean? Okay, and like, sorry,
I'm Lola.
Lola prefers society
Yes.
because you think everyone is invisible to get sick, and what's more important is that whether the society can provide healthcare resource, and whether they are in regard to the price and its effectiveness or something like that. And you also refer to cultural explanation, just like Ling Ling, you said. Poor people have a great higher risk of getting ill, right? Okay, then anything else to add to this question?
No.
we've done a quick job. And so, how about the fourth? What do you think of health inequalities?
Health inequalities.
Inequality.
Yes, I think it can be integrated in many aspects, like the gender inequalities, health inequalities, or the social class inequalities. They are both. They will all lead to health inequalities.
Oh, can you explain more in detail?
Such as the gender inequalities, and just like the reading materials told us, as research shows, maybe women will live a longer life than men.
Maybe live shorter.
Shorter, really?
I longer.
I think it's longer. There is one sentence I recorded here. At all ages, women's death rates are much lower than men's, and men's overall death rates are more than 40% higher than those of women. So there is kind of natural inequalities. And maybe this can also be attributed to men. Basically, more men tends to work outside, and they may do very manual works than women. Also, we all know that many of them may have terrible habits like drinking or smoking. Yes, but this is one of the inequality, I think. And also, just as we mentioned before, the social class inequality.
I think the health inequalities refers to some social class inequalities, just like the rating text says. The class 5 people have higher chance to get risk and shorter life expectancy compared with class 1. And the people who live in the poor area have less resource and more difficult access to GP compared with other rich areas. So it's kind of social health equalities.
Different people have different lifestyles and attitudes toward their life. Some people may abuse alcohol or drug, do something bad. They contribute to health inequality.
So, but the question is more about the definition of health inequality.
Definition.
Can you explain it, or what you think is health inequality? The fourth question.
Poor people tend to get sick more often.
Yes.
And there is also a universal care law existed. It said most people in need may not have enough health care, but the poor people they do not need much these services, but they have easy access to these services.
The definition of health inequality. I agree with you. So, anything else?
No.
So let's summarize again. Laura, you said just now, health inequalities can be in 3 aspects. One is gender,
Yes.
and the second one is maybe us. So maybe just
Two, yeah.
yeah, a social class, and you explain more in the gender.
Yeah.
That's women tends to live longer than men.
Yeah.
And you list statistics like about 40% of men who live longer than women.
Yes. It
Thank you.
actually refers to death rate.
Oh yeah, the death
Men's
rate.
overall
Sorry.
death rates are more
Sorry.
than 40.
Okay. I think it's a natural one.
Actually, it's not. It's a combination. I think it could be natural factor in some sense, but also the bad habits or their jobs can also lead to.
Oh yeah, they're mostly because they are more likely to have a poor lifestyle, like drinking and smoking, and they tend to work outside than women. So, Claire, you think the social class is what health inequalities mean? And you and Ling Ling both said the poor have a higher risk to get ill, and also Claire said their life expectancy tends to be lower, and they have less resource to get access to the GP.
Yeah.
Right?
Yeah.
And then you mentioned the inverse care law. That's exactly what is the fifth question. Yeah. And yeah, that's you can explain it again, and we can finish the fifth question.
So we don't need to talk about how to solve
How to solve?
the health inequalities.
Oh, I just by the way finish it and then come back to how to solve.
Because of the social classification, health become worse due to inequalities in the national health services. Therefore, in equal distribution of social resources, they make poor people have fewer GP practices and fewer doctors, so they may be more likely to get ill. And furthermore, they also have less time with GPS.
GPS.
Because they have to work, they have less time with GPs. And furthermore, because they do not have enough money, so the places they go to may be overcrowded and they do not have advanced facilities for them.
So, are we all understand about the definition?
Good explanation.
Yeah.
Wonderful.
To read my notes.
So let's come back to how to solve health inequalities.
Maybe we should tell men to develop more good habits.
Yeah, healthier lifestyles. And the government can make some policies to make the income gap become short, become
Next.
yeah, become less.
Income gap.
Because the social class, the inequalities, and most people who are in the social class 5 are manual worker, and the social class 1 are the professionals. So their income gap are very huge, and the government can make some policies to make their income more equal or much less gap.
Maybe we can make a more clear structure we can divide it into two parts.
The
One,
income distribution.
what I mean is to solve this health inequality, we can divide it into two parts to discuss. One is the individual themselves, and the second one is the society.
Yeah.
Is it
Individual is healthier lifestyles and better habits, especially for the men. Yeah.
okay?
And the society aspect I mentioned before, to make the income gap become less, and the government can make some policies to make the income distribution something like that.
Basically, in accounting, we tend to use tax to adjust the differences of income in different classes.
Yeah.
I mean, just apply more tax to those rich people. Yes.
And how about individual aspect?
Individual.
Except for lifestyle, anything else they can do?
No idea.
Emotional needs.
Ah,
I think
yeah.
the family members can give the people who are working outside and heavy workload more emotional support. And yeah, I think
So who should provide the emotional support?
I think the, for instance, if husband work outside and have much pressure, so the wives and the children can give some emotional support to tell him that he's good or excellent.
To encourage him.
Yeah, encourage. Yeah.
I think for the individual aspect, especially poor people, they need to learn some basic knowledge about some diseases, and this will help them to assess their health conditions, and to have maybe they also can communicate with their doctors easily to talk about their symptoms. And for the society aspect, I think the government should allocate more money to build more health care services and organizations to help people in need to improve their health level.
Okay. So I remember you mentioned environment in the last minutes of the discussion. Maybe we can do something to...
Can you see the in society?
Yeah.
I think the government can make some policy or something to encourage public to be more environmental friendly, yeah, and go green or something, yeah.
I think it's also important to eliminate the, pottery. What pottery? Regional pottery, or I mean distribution of medical resources is unfair in sometimes. So we have the inverse case law.
Yeah.
So I think government should to make some policies to stop this inequality of
So you see the
distribution of medical.
distribution of the drugs can be more equal in the future.
Yes, but I'm not sure what can government do to
Yeah, me too, but I know what you were saying.
just the word that we mentioned in the listening material yesterday, the pottery, the lottery of
Postcode lottery.
postcode lottery, right?
Yeah.
Postcode
Lottery.
lottery, LOTT. How can we distribute these resources more fairly?
I think it is the job of the government, and I think it is quite a difficult process.
It's quite professional.
Yeah, because if it is easy to solve, I don't think this postcode lottery is a problem. No, I really don't know how to.
Let's summarize,
Yeah,
or
okay.
you want to move on to.
You summarize.
Okay. In terms of how to solve health inequalities, Claire, you said maybe in terms of in the individuals themselves, they should have a better lifestyle, especially men. And also, you mentioned emotional family members. They should care more, yeah, and give some more support for their so people who work outside and have a great pressure. Yeah, and also for the society, you mentioned the income gap. Yeah, and Laura, you said you put forward a way to.
Time's up.
Time's up.